Healthcare reform is at the top of the president's list. And today, New Mexico Congressman Ray Luján hosted a roundtable discussion on the issue. News 13's Alex Tomlin is here with more.
Kim, this meeting wasn't designed for citizens to weigh in on the president's plan for more government-involved health care. Instead, it was a chance for them to give their feedback on what they think needs to be done to improve the health care system. Athea McLucky's daughter is playing a waiting game for reliable medical equipment.
My daughter depends on a feeding pump, okay? We have gone through 11 feeding pumps in the last month because we cannot get reliable ones. I have been feeding her with a syringe instead of a feeding pump for the last 2 weeks because the pump that was supposed to be on our way to us has never materialized.
Dr. Christine McCoy runs a rural health clinic. She says problems in the system have contributed to 2 deaths in the past week.
There's a case of a young man who unfortunately passed away last week, 38 years old, colon cancer. No one would see him except for UNM. UNM had a waiting list of about 6 weeks. By the time he got to UNM, he got started on chemotherapy and then died within a matter of days.
Just yesterday, a woman died in Dr. McCoy's clinic. She says they couldn't save her because the clinic doesn't have full emergency resources. Dr. McCoy says the equipment and training are too expensive for the small facility. Diabetes patient Maureen DeJohnny also knows about the system being too expensive. Years of not being able to get health insurance are straining her family's finances.
It drained all our savings. We had to go into our IRA just to get my medications. My one medication is $650 for 1 month.
Congressman Luján says he's asking New Mexicans what they need from their health care provider to ensure everyone can get affordable insurance that will meet their needs.
We'll continue to have conversations with constituents throughout the process and even thereafter because as we move towards healthcare reform, there's always room for improvement, and we always are going to have to make sure that we're looking to those individual stories to see how we can best help them with their needs as well.
Other members of the group urged Congressman Luján to think about how people will get treatment once some type of reform is put in place. They say the state has a critical shortage of primary care physicians, and that's a huge problem that needs to be addressed. Back to you.
Okay, thanks, Alex. Now, the president has asked for a health care reform bill by the end of the year.